The field of genetics went from being really a field that dealt with the very rare and unknown, usually with children with rare birth defects or individuals with cancer syndromes. And it's really transformed into a very all-inclusive field that touches every aspect of medicine. Any family who has a history of mental retardation, birth defects, developmental delays, young onset of disease. So if there's a family history of a disease that normally presents in older individuals, but most of the family is presenting young, that would be an indication to come in to see a geneticist or a genetic counselor. Pregnancies who are at risk, so again, whether it's family history or an abnormality identified on screening, to understand what the options are, understand what the testing options are, and understand the natural course of whatever they screen positive for. Questions that I would ask if I were a patient that is considering undergoing genetic testing is, what are the outcomes of the testing, and what are the chances that the testing will pick up whatever abnormality we're looking for? I think a lot of physicians may not realize that if they order a genetic test and it's normal, it doesn't exclude a genetic cause for that patient's abnormality. It just means that it wasn't due to whatever specific test they were ordering. So I think just understanding the limits of the testing that they're doing and the potential outcomes of the testing and the next steps. Sometimes there may not be additional steps, or we're waiting for technology to continue to identify genetic abnormalities. But I think it's important to understand that there are limitations to this testing. If I see a patient and we do as much testing as we possibly can, we don't always arrive at a diagnosis. But I think it's very important for those patients to follow up, because we have ever-increasing knowledge about genetics and the genes that cause disease. And just because that test may not be available at the time of their appointment, it could very well be available in a year or two. There's the whole stigma of having a genetic disorder, and somebody did something wrong, and I think that's what's perpetuating some people's. But I think it's also important to know that different families desire different levels of information, and some families just don't want to know. And even though as physicians we want to know as much as possible, it is a family's right to know or not to know. I think there's fear that it would be used against them, but there is this a new law that was signed, the Genetic Information Non-Discrimination Act, and it was put in place to protect individuals who are interested in learning more about their personal genetic risk without fear of discrimination, so employment discrimination and insurance discrimination. Doesn't it protect against things like life insurance and long-term disability and some supplemental insurances? But it does at least provide a family with some protection.